coughing, headache, body ache, difficulty in breathing. The disease can be prevented by regularly washing hands with soap and running water. Avoid close contact with people who have flu-like symptoms. Avoid handshake, hugs, and kissing. Also, protect yourself by covering your mouth or nose using a disposable tissue while coughing or sneezing. If you experience these symptoms and you had traveled or been in contact with a person from a country reporting COVID-19, you should isolate yourself for 14 days and seek immediate medical attention or report to the nearest health center. This message has been brought to you by the government of Kenya and its partners. For accurate information on COVID-19, dial *719# or call 719. Follow us on Twitter at MOH_Kenya, at spokesperson GOK, at WHO.
Hello, good evening, and thank you so much for joining us for this live discussion this beautiful Thursday evening. And as promised on our social media handles, we have discussing today St. Mary's Mission Hospital. Of course, we have organized this special discussion live on Capuchin TV. I would like to apologize. We were supposed to start exactly at 4 p.m. East African time, but due to some hitches here and there, we are late, so apologies for that. And here we are. They say better late than never, right? So today we are with a guest here, a sister. She is a big person at St. Mary's Mission Hospital. Give us her a few seconds to introduce herself before we move on. Sister, welcome.
Thank you very much.
Good to see you.
Nice to see you too.
Yeah, feel at home.
Thank you, thank you.
Now please tell us who you are and what you do at St. Mary's Mission Hospital.
Very much. My name is Sister Dr. Carren Owuor. I'm an Assumption Sister of Nairobi, and currently I am the Chief Executive Officer of St. Mary's Mission Hospitals, both in Nairobi and Rift Valley Elementaita.
Wow.
Yes.
Welcome. All right, so we have planned this special discourse just to fill you in and let you know of what St. Mary's Mission Hospital is, why it was started, and the kind of services they offer, and of course, pertinent details that you need to know as a patient or as a person who needs services, who would like to get medical services from St. Mary's Mission Hospital. So welcome, my name is Asashi Elizabeth, and let's talk health. So sister, to start off, tell us briefly what St. Mary's Mission Hospital is.
St. Mary's Mission Hospital is a Catholic faith-based hospital at level 4, and it's owned and managed by the Assumption Sisters of Nairobi. The core reason why St. Mary's Mission Hospital was started was basically to be able to take care of the health needs of the people living around Kibera and within Nairobi who are not able to access healthcare services in other high-end hospitals. So we were basically to reach out to the people within our locality. If you look at the strategic location of St. Mary's Mission Hospital, Nairobi, it's adjacent to the Kibera slums, basically to ensure that they can be able to access quality healthcare at an affordable cost and close to them within their vicinity. Okay. So that is very key for us at St. Mary's Mission Hospital. And that mission, we keep carrying it on.
All right. Yep. Is the mission somehow linked to the strategic location of the hospital?
Sure. It is because for us to have strategically located St. Mary's where it is, we had other options. We could have located it in Galleria Mall, around that area, but we looked at the accessibility. And so because we wanted to reach to the most needy and the lowly at that particular time, that was around 2009, we looked at St. Mary's Mission Hospital as being strategic near Kibera. And we know there are other informal settlements within Nairobi that St. Mary's Mission Hospital has been able to take care of. And this is because we looked at the cost of healthcare in general within Nairobi. It was very high. So then many people would stay at home and fail to go and seek for medication, yet they are sick. So this was the main reason that we wanted to break through, and it is in line with our founder as an Assumption Sister of Nairobi. Our founder wanted us to uplift the dignity of the lowly. So that is a call that is key to us.
Thank you, Sister Carren. Now, what's your coverage and capacity as far as healthcare services is concerned?
Mary's Mission Hospital, we have 2 branches, one in Nairobi, one in Rift Valley Elementaita. In Nairobi, our coverage is within the Nairobi Metropolitan, but it spreads across the entire country actually. So we get patients as far as West Pokot, Turkana, and even across the borders in Uganda. We have patients from Burundi, we've had patients from Burundi, and in the Rift Valley, we've actually had patients traveling all the way from Ethiopia, and they are within our vicinity. In Nairobi, the hospital is located near Wilson's Airport, so we've had referrals from Turkana and even Ethiopia into the hospital. So we cover broadly, we are not limited to just Kibera, so the scope of coverage is quite wide.
Wow.
Yeah.
Oh, that's great. Now, what in hours?
St. Mary's Mission Hospital is open 24 hours, 7 days a week. And that takes care of all weekends, whether it is Saturday, it is Sunday, it's public holiday. From 24 hours means the whole day. So there is no limit to when you'll find St. Mary's Mission Hospital closed, because we believe and we have experience that illnesses do not have timing. It could be in the wee hours of the morning, it could be any time. So that's why the hospital is open 24 hours. And that is now, it's tomorrow, and it is in the future.
Wow.
Yeah.
Thank you so much for that important details on the operational hours. Now, someone who was watching would like to know the kind of services that you offer both at St. Mary's Langata and Rift Valley.
The hospital are replicative in Nairobi and Rift Valley, meaning the services that we offer cut across. So St. Mary's Mission Hospital, at its level 4, both of them are at level 4. We offer both outpatient services, inpatient services, and support services. In our outpatient services, we have walk-in patients. That means the general sickness, a fall, you have a runny nose, you have been bitten by a snake, something like that, you run into the hospital. So those day-to-day illnesses that will need an attention of a medical personnel, those are offered. We also offer services pertaining to the mother, the child health. So we take care of antenatal clinics where mothers who are expectant come. They are taken through the whole journey of carrying this precious life in them through the 9 months. And that entails a lot of education, a lot of support, both mental, psychosocial, and also being able to just journey with that mother. There are vaccinations and there are clinics that are scheduled for the same. And we have the children's clinic. Basically, these are babies. They've been born, they need to go through their scheduled vaccinations. So that is also offered in that maternal child health clinic. And we have other services within the outpatient that ranges from nutrition support. So we have clinics in the nutrition department that help you and me either gain weight or lose weight, because we realize our health is so vital and it rotates around that. So we need to keep healthy, so that support is there. We have the counseling services as an outpatient. We have other specialized clinics. When we talk about the specialized clinics, we realize that these services are so expensive out there, but we have reached out to special consultants who understand the mission of St. Mary's Mission Hospital, which is basically to provide quality health care to the most needy, but it's expanding to the scope of anybody in need of health care. So these specialists range from a physician. A physician is somebody who will take care of your heart issues, diabetes, hypertension, asthma, and many of these day-to-day chronic conditions that are repetitive. We have a pediatrician. That one takes care of our children. After they've gone through the clinic, they've gone through the wards, admissions, they go into the clinic for further treatment. So we have a dedicated pediatrician on board. We have a pediatric surgeon who also runs a clinic. And there are so many illnesses or ailments around the surgical complications of children, ranging from hernia. Maybe you gave birth to a child with an abnormally large umbilical cord, so it protrudes outside. It is, some people think it's normal, but then you can find that the intestines can be trapped in there. So this pediatric surgeon is very key. Sometimes we have hernias that rotate around the genitalia of the genital region of the babies, and these, when they the intestines get fixed in there, it's an emergency. So the pediatric surgeon takes care of that, evaluates them at clinic, but also can take care of the surgical part. And then we also have within those specialized clinic, the surgeons, the general surgeon, orthopedic surgeons who deal with the bones. The general surgeons will deal with all other surgical conditions ranging from your thyroid, maybe masses, swellings around your body. Some could be just fat, some could be malignancy or things that need to be evaluated further to find out if they are cancerous or they are just normal. We also have within that surgical specialized clinic consultants who deal with your liver, your pancreas, and your gallbladder. That whole system has complications, and those are evaluated. Sometimes you see somebody walking and the eyes are so yellow, and you're wondering, did they color their eyes? No. It's a process. It's a process that is not normal. Either there's a blockage or there's something that a surgeon with that specialty needs to look at. So in that whole scope, we also have an oncologist on board. Oncologists are specialists who deal with cancers. In our world today, cancer has become quite rampant, and we've been very slow in diagnosing the same, but due to technological advancements, we are able to diagnose. So when we take biopsies or some samples from your tissues to go and analyze, and it turns out positive, we subject you to that clinic for follow-up, for treatment.
So you do that at the hospital?
Yes, at the hospital. So within the special clinics, you'll be evaluated, and then you will be given appropriate treatment. And we have many more specialized services within that arena. If you want to get to know more, kindly visit our website and you'll be able to get more.
All right. Of course, there is an array of services that are offered, inpatient, outpatient, and consultation services. Yeah, so you can just get in touch through their website and get to know all about the services that are offered at St. Mary's Mission Hospitals. Now, back to you, sister. Do you offer any other support services apart from the ones you've mentioned, inpatient, outpatient, and the consultation services?
For sure, St. a big hospital, big in terms of the coverage of services. So I talked about several of them. We also offer maternity, which is very key for us. There are so many mothers, I'm sure even out there as you listen to us, you must relate somewhere. Either your child was born there, your relative and all that. So maternity is very key for us. In terms of support services, within a hospital setting, we have the pharmacy. And our pharmacy is well equipped. If you miss out drugs at that pharmacy, probably it's out of stock in the entire country. But we strive to ensure that even when we get the high-end drugs, it's at an affordable cost. And this pharmacy is open for those patients that are on board, as well as patients that walk in to just come and get advice and get medication. We also have the laboratory services. Our laboratory is ISO certified. That means the standards within that lab are comparable to the international standards. So when we send you to the laboratory, we are very sure of the quality of that lab. It can be related to other high-end laboratories within the hospitals in our nation, Kenya. And that is quite key for us because it gives us the power and confidence to be able to help our patients get the right management after the diagnosis. Yes, and in addition to that, we have radiology services. And radiology basically ranges from x-rays, all arrays of x-rays, CT scan, but also the ultrasounds or the sonography part of it. So those are also lumped up within the support services. They help doctors to be able to make a better judgment. Yeah.
Okay, thank you, sister. Now, is the hospital accredited by the NHIF, and do you accept other corporate, private agencies, insurance agencies?
For a long time, we thought about NHIF and what it is doing to the nation. And for sure, St. Mary's Mission Hospital is accredited. We are contracted within the comprehensive package. And it's important for the public to understand that comprehensive package means that when you have a surgical problem, whether you're coming in to have an operation or you have any lump that is in any area and needs to be removed, you'll walk into St. Mary's, and once NHIF approves your procedure, you will be able to have that procedure catered for fully. So you will not be able to pay any extra cost to it, and you will be able to walk home when you're safe. So that has really helped us reach down to the people who are most in need of the services.
Right.
Yes.
Okay. So what about other private insurance agencies?
Yes,
are you welcome to them?
They're actually welcomed on board. We have several, and probably when you visit our website, you'll see all of them. There are quite a number, and those of us who are covered and do not have to pay out of pocket, please visit us in our website. You'll get to know all the other corporates that we are linked to, and also other management schemes, the managed schemes.
So someone asked, do you offer mental health care services and counseling?
Oh sure. Mental health has become a major problem for us, even as healthcare providers. And within St. Mary's Hospital, we have the pastoral care, we have the counselors on board, but we also have a psychiatry on board. So the psychiatrist will be able to take care of the medical or mental health issues. The counselor will be able to journey with you through the process of healing, but we also support that with the spiritual aspect where the pastoral, the chaplaincy comes on board. Yes.
So on mentioning what does this department offer? Because we understand that every mission facility has a chaplaincy department. What kind of services do you offer to patients and their loved ones?
Actually, the chaplaincy department in a healthcare institution like St. Mary's, which is Catholic Mission Hospital, first and foremost, it's to ensure that the spiritual care is taken care of for both the staff, the patients, and their relatives. So offering masses, but also there are other sacraments that they offer, so confessions, anointing of the sick, and the chaplains that we have are specialized counselors as well. So there are people who have done psychology, so they are able to penetrate deeper, not just the spiritual, and they accommodate anybody in need, whether you're Muslim, whether you're Hindu, whether you're Catholic. They will be able to welcome you, listen to you, and be able to offer you that journey that is more inward, more soul-searching, and more health rejuvenating. Yes.
Thank you, Sister Carren. Now, what about, do you offer transport services and farewell home services to patients?
Oh, sure. In a hospital setting, we do not wish to have people succumb, but sometimes you have reached that stage where the Lord wants you more. Sure. And so when it reaches that end, we have a funeral home that is decent, that is welcoming to those people who visit, and it is open to both the patients who unfortunately pass on within our hospital, but also people from the public who have maybe their relatives who have died and you don't have anywhere to take them, St. Mary's Mission Hospital Funeral Home welcomes you. We also have ambulance services, and these ambulance services are not limited to just referral. They are also open to evacuating. So if you have a sick person at home who has maybe collapsed, the sugars have gone down, or there's a road traffic accident somewhere and you do not remember an ambulance, just get into St. Mary's Mission Hospital's website. You'll get our contacts there, and the ambulance will be able to evacuate and take to the right hospital.
Thank you so much. Are you up to date with technology in as far as the hospital management is concerned and the delivery of services to patients?
In this era, if you're not up to date with technology, you'll be bypassed by so many events. So at St. Mary's Mission Hospital, we have a hospital management information system that has linked all our services, and this has eased out the turnaround time for patients, also improved the patient journey, and prevented a lot of carrying of paperwork. So we are going towards total paperless, but we have not reached the total paperless. That is our vision for the inpatient, but we have that management information system that links all the departments.
Currently, so many health facilities are embracing wellness healthcare as part of trying to ensure that they focus more on prevention rather than curing ailments. Do you have a wellness clinic at St. Mary's Mission Hospitals?
Sure, we have developed several packages for wellness just because of what you have already alluded to. Our health is our priority. It's you to take charge of your health. And we have realized that it's not important for us to just focus on treating. We need to help each other prevent all these parameters that are leading us to that. So we have wellness packages that are designed for the adolescent, because we realize at that age bracket there are some challenges that you can be able to check. We have those that are for women and men below 40 and after 40, and even those in their golden years. So you're most welcome to come and inquire more and be able to understand, because you must take charge of your health. I must take charge of my health.
Absolutely. Thank you so much, Sister Carren. Quite an informative discussion there about St. Mary's Mission Hospitals, the kind of services they offer and how different they are from the rest of the healthcare facilities. We'll take a brief break and we'll be right back with more on this. Stay tuned.
Coronavirus COVID-19 is a respiratory virus spreading across the world. The infection is spread from droplets of coughing and sneezing of an infected person, touching or shaking hands, or being in contact with contaminated surfaces or objects with the virus. The signs and symptoms are fever, coughing, headache, body ache, difficulty in breathing. The disease can be prevented by regularly washing hands with soap and running water. Avoid close contact with people who have flu-like symptoms. Avoid handshake, hugs, and kissing. Also, protect yourself by covering your mouth or nose using a disposable tissue while coughing or sneezing. If you experience these symptoms and you had traveled or been in contact with a person from a country reporting COVID-19, you should isolate yourself for 14 days and seek immediate medical attention or report to the nearest health center. This message has been brought to you by the government of Kenya and its partners. For accurate information on COVID-19, dial *719# or call 719. Follow us on Twitter at MOH_Kenya, at spokesperson GOK, at WHO.
Kipaimara Ni sakramenti yenye kumpa Mkristo Roho Mtakatifu na ukamilifu wa mapaji yake 7, kumfanya Mkristo mkamilifu na kumfanya shahidi hodari wa Yesu Kristo mpaka kufa.
Kupata kipaimara kama Skiza Tune yako, tuma neno Skiza likifuatwa na nambari 738100272 kwa 811.
Coronavirus COVID-19 is a respiratory virus spreading across the world. The infection is spread from droplets of coughing and sneezing of an infected person, touching or shaking hands, or being in contact with contaminated surfaces or objects with the virus. The signs and symptoms are fever, coughing, headache, body ache, difficulty in breathing. The disease can be prevented by regularly washing hands with soap and running water. Avoid close contact with people who have flu-like symptoms. Avoid handshake, hugs, and kissing. Also, protect yourself by covering your mouth or nose using a disposable tissue while coughing or sneezing. If you experience these symptoms and you had traveled or been in contact with a person from a country reporting COVID-19, you should isolate yourself for 14 days and seek immediate medical attention or report to the nearest health center. This message has been brought to you by the government of Kenya and its partners. For accurate information on COVID-19, dial *719# or call 719. Follow us on Twitter at MOH_Kenya, at spokesperson GOK, at WHO.
Amri za Mungu. Ndimi Bwana Mungu wako. Usiabudu miungu wengine. Usilitaje bure jina la Mungu wako. Shika kitakatifu siku ya Mungu. Waheshimu baba na mama, upate miaka mingi na heri duniani. Usiue. Usizini. Usiibe. Usiseme uongo. Usitamani mwanamke asiye mke wako. Usitamani mali ya mtu mwingine. Amri za Mungu.
Kupata
amri za Mungu
kama Skiza Tune yako, bonyeza neno Skiza likifuatwa na nambari 738100251.
All right, welcome back, and thank you so much for keeping it Capuchin TV right here as we discuss all about St. Mary's Mission Hospital, trying to give you a deeper understanding of the kind of services that are offered at St. Mary's Hospital, their uniqueness and what they are committed to do, the impact they are committed to make in the healthcare sector. Now in studio, I have the CEO of St. Mary's Mission Hospitals, Sister Dr. Carren Owuor. Welcome back to our second session.
Thank you very much,
And
Sasha.
thank you for the first very informative session. Now, before we went for our break, we mentioned about NHIF. So for the sake of the patients or someone who's watching and would like to seek medical services at St. Mary's Mission Hospitals, what kind of services does the NHIF cover at St. Mary's Mission Hospitals?
So for services that are covered by NHIF, they range from optical, that is if you have issues with your eyes and you need glasses, the dental care, And the CT scan is also a service that is covered by NHIF. And all these three services, they need to be pre-authed. So we have to send a request to NHIF pertaining to the possible procedure that we want to take care of, and then NHIF has to approve that. Once they approve, you walk into St. Mary's, or we will give you a call, and then you come on board, we evaluate you, admit you, do the procedure if it is for admission. If it is a day case, you will also be able to have it done as a day case, and you go home. And then it also covers the inpatient. So if you are admitted into the wards, NHIF will be able to pay for your hospital stay.
Is that a full payment or a...
Yes, it is a full payment. Remember, before we went for a break, I had given you the contractual position with of St. Mary's with NHIF, and we are in that comprehensive bracket where when you get in and you are NHIF contributor up to date, so the public, as we are speaking, we need to keep our NHIF contributions up to date. So that is the only ticket you have to be able to have your health taken care of by NHIF in conjunction with St. Mary's Mission Hospital. Yes.
Thank you so much. Now, St. Mary's Mission Hospital was started as a maternity facility, right? So tell us about your maternity services. How different are they compared to the ones offered by other health facilities around?
Okay. St. Mary's Mission Hospital was started as not basically specifically maternity, but broad, but maternity stood out. Many mothers would find a lot of comfort and solace in seeking delivery services at St. Mary's because of the aspect of compassion. Compassion means being present in the life of that particular person who is before you at that particular time. So St. Mary's Mission Hospital prides in the maternity. We have delivered more than 2,000 babies in the course of 3 years in St. Mary's Mission Hospital. And this is because of the trust that the mothers have with us. In maternity department, we have invested a lot. We have invested in the human resource. So that takes care of the specialized nurses and midwives. We have experienced midwives who are able to train the younger population of nurses. We have dedicated doctors, medical officers who are dedicated 24 hours in maternity to take care of our mothers and the little ones that are still bouncing in their uterus. We also have dedicated obstetrics and gynecologist consultants. These are consultants that are on standby should there be any complication that can be able to salvage or save a life. Maternity is quite risky, so that is the reason why as St. Mary's Mission Hospital, we have taken a lot of caution to ensure that a mother walking in and out of St. Mary's to deliver goes through that journey successfully and with adequate support. Thank you.
Thank you so much, sister. Now, do you have any private wards or private amenity at St. Mary's hospitals?
We have realized that our clientele is growing. There is a space that is coming on board that needs a lot of privacy. Initially for St. Mary's Mission Hospital, we knew whether you are a sister, you are the president, we are all human, equal before the Lord. Sure. So we didn't have any issues with having privacy and all that. But as the generation is changing and there's a lot of demand for that service, we have been able to develop an amenity or a private wing that is very, very affordable. It's a home away from home where you will be able to stay with your family. Just off this COVID-19 period, we have put a bit of restrictions because of the Ministry of Health restrictions as well, and also protecting the patients in that space. So we have a private wing for those of you who wish to be to take some time out of their home, even to rest and be supported by the pastoral care, the counseling department. You just need to have a conversation with the doctor. You are also welcome, but it is there and it is very, very affordable.
All right. Yes. Now, do you have How different are the services offered in the private wing from the general ward wing?
Actually, the services, I wouldn't say they are different because of our consultants cut across, but the difference comes on board with the ambience, the one-on-one, the privacy, and you have the opportunity to stay with your relatives, which we do not have in the other wards. And that is a plus for people who want to have a bit of home away from home. Because we realize that when you are hospitalized, it's a strange environment and you tend to be isolated from your family. So when you have that space where you can bring them on board, and that is only found in the private ward. Obviously, you have the opportunity to choose whatever meal you want. You have the comfort of seeing what is going on at the comfort of your bed in terms of the connection with the media. So there are those frails, there are those small things that are add on.
Awesome.
Yes.
Actually, there are sneak peek videos on St. Mary's Mission Hospital documentary, so you can check it out on Capuchin TV's YouTube account and see for yourself the comfort and the coziness that comes with the private wing. All right. Do you have any outreach clinics besides the two hospitals?
It's only now that we are thinking of expanding, and we have an upcoming clinic, St. Mary's Mission Hospital Clinic at the CBD, that's the Central Business District. If you know where the Holy Family Basilica grounds are, on the annex, Cardinal Otunga Annex Plaza, third floor, we are going to have our outreach clinic there. It's a clinic, but it is going to take care of almost all the services that you can find at St. Mary's Mission Hospital, Langata. The specialists will be on board, and we will have a lab, we'll have a pharmacy, and we will have the emergencies, because you can never know. Wherever there's a health care center, you'll always have emergencies. So those are well prepared for, and we are hoping to bring on board this come next month, around mid-June. So by mid-June, we should be having the first St. Mary's Mission Hospital CBD clinic. And it is a joy for us because it's not only the expansion, but we are moving these services from Langata closer to the people. We support a lot of the elderly and the needy people in Basilica, but also from our analysis, our clientele are coming from all over the country. So that is a little bit shorter for them in terms of transportation, also trying to cut on the cost. So it's a great venture for us, and we are really looking forward to it. The public should be excited as well.
Sure, for sure, that's a reason to smile about. Okay, so now how prepared are you for emergency cases, both at Elementaita in Rift Valley and in Nairobi, especially when a patient comes in? So many things happen that require urgent health care. How prepared are you for that?
In any health institution, you always have an accidents and emergency department, and you develop the human resource to match that department. So for St. Mary's Mission Hospital, Nairobi, we have the crash team or the emergency team. And whenever a patient is brought, okay, the referral system is good, they have to call, alert us. But there are those that will just pop in because it was an emergency, maybe a road traffic accident, a fire breaking out in Kibera, which is very common, or somebody just collapsed. So we have put in systems in the two hospitals, but I'll talk first about Nairobi, where if we get an emergency, it's not a one-man show, it's a team. And that team will be able to take care of you. It comprises of the clinical team, that is the nurses, the clinical officers, the medical officers, the consultants, the emergency physician, and they will be able to take care of that. If these emergencies come off the hospital, our ambulance and the team is very ready to move and evacuate. In the Rift Valley, we are strategically positioned along the Nairobi-Nakuru highway. Actually, we are just on the roadside. And this is strategic, but also a very easy way to access the healthcare if you are in such an environment where maybe you're in the road traffic accident or gunshots, or you have been hit by an animal, because we have buffaloes along the Lake Naivasha and all that. Sometimes they cause a lot of damage to our muscles and all that. So the hospital's emergency team replicates across. So it's composed of the same team. Yeah.
Steve, who is viewing, is asking, do you have a ENT? Do you offer ENT services at St. Mary's hospitals?
Oh, sure. The ear, nose, and throat are very, very common conditions, and especially within the children's age, but also in adulthood. So we have invested in medical doctors, clinical officers who have a specialty, a subspecialty in that area, but we also have a consultant ENT specialist on board. So the cases that we can be able to manage as outpatient will be managed. Those that need admission will be admitted, but those that need the consultant's special care leading into surgery and operations, those are also offered at St. Mary's Mission Hospital at a very affordable price. And if you are an NHIF contributor, almost free. You will walk out without coughing out of your pocket.
Wow, that's wonderful. All right. So now, do you offer any other form of occupational therapies to patients, for instance, who have stroke, who have suffered stroke, or any other ailment that calls for such services?
We realize when you become debilitated, whether it's from stroke or you got an accident and you're not able to carry out your functionality, that support is very key. So St. Mary's Mission Hospital has a physiotherapy department that takes care of ensuring that you can get your functions after an ailment or an accident. And this department is very well structured. It has a lot of parameters. When you go in there, you'll receive different sections that deal with different areas. And to add on that, the hospital has invested in occupational therapy. Occupational therapy is very key for children who are growing with delayed milestones. Maybe they were not able to walk in time, they delayed in their speech and all that. But also for those people who have suffered stroke and their speech is slurred, is not they're not able to communicate well. After you do the medical treatment, there's that support that they need. Speech therapy is very, very important, and it is very expensive in our country. The specialists are very few. So as a hospital, we have thought through how we can bring these services to people, but at a very affordable price. So we have an occupational therapist on board who is very passionate about ensuring that if you are able to talk before that incident, you come back and talk just as perfectly as before. And
That's
that is
so encouraging.
Yes, that is very, very encouraging. Yeah.
Okay, being a nun, do you have what's the contribution of other nuns in the hospitals?
The Assumption Sisters of Nairobi. And we take care of many areas. We take care of the social area, education, but key to us at St. Mary's Mission Hospital is health. And health is in wholeness. So we take care of your mental health, your psychosocial support, but the sisters are also professionals. I just said that I'm a medical doctor. Many of us are nurses trained. We have trained counselors. We have trained accountants. We have trained lab technicians. So the sisters work within the various departments. And this is very, very strategic, as I have been alluding to. Our motto is compassion in healthcare. We as sisters are not just there as workers. We have a call to be able to offer these services to people. So we have strategically ensured that in our various departments, both in Nairobi and Rift Valley, the face of a sister is there. Not just as an advertisement, but to be able to reflect that healing ministry of Christ. And that is the core reason why we have close to 20 nuns in Nairobi and close to 12 or 15 in Rift Valley offering the healthcare services.
Wow, interesting and quite profound. All right. So about a partnership with other institutions of higher learning, do you have some exchange programs that you do just to prepare or to make sure that you hone the skills of those who work closely with the patients?
Sure. St. Mary's Mission Hospital for a long time has invested in training. And for now, the hospital partners with around 5 to 6 institutions of higher learning, especially in the nursing department. So we partner with CUEA, Catholic University of Eastern Africa. We partner with the Kenya Methodist University. We've partnered with most KMTCs, the Kenya Medical Training Schools, both for nursing, nutrition, and currently we are accommodating the medical, the doctors who are out for internship and clinical officers, and we are open to other subspecialties. The focus for the future for St. Mary's Mission Hospital will be to invest in a training, a health institution where we can be able to grow personnel that actually buy into our mission and vision and cultures and values and are able to replicate the same to the public. So it is a team of professionals with a focus to be able to deliver that quality healthcare, but with compassion.
Thank you so much, sister. Judith Erumbi, watching from Mombasa, you have a critical care department.
At the moment, we do not have critical care department, but it is one of those areas that we are investing in. When we talk about critical care department, as I had said, we are at level 4. If we have that, we will go to level 5 or 6. And this basically is the intensive care unit, the high dependent unit. We also have the renal unit, and these are areas of focus for us as an institution. Together with the owners of the hospital and our board, we are working to ensure that within this year, before it closes, we will be able to bring on board critical care. Yes.
So that's a part of your future plans?
Sure.
Yeah. Do you have any other future plans besides putting up a critical care unit?
Yeah. The greatest future plan that we have is developing the education sector within the health system. We are going not only to look at nurses, but we want to be all round. So we are looking at public health, we are looking at nurses, we are looking at the various other components of healthcare provision, whether it is lab, it is pharmacy, medical records, because these areas are all very key to an institution. And if you can invest in growing those personnel, you have an advantage within the market. Our goal is to be able to reach to a level close to Kenyatta and beyond, that is level 6, where people will walk in and find all the services, all the specialists, where we do not need to refer you. If we have to refer you, probably it's something that is not found within the country. That is where we are going.
Wonderful. Now, as we wind up, because time is against us, St. Mary's Mission Hospitals is known for its memorable slogan or tagline, compassion in healthcare. So someone would ask, someone who would like to experience this compassion in healthcare would ask, why would I choose St. Mary's Mission Hospitals over the other health facilities or hospitals around? What is it that you do differently or uniquely at St. Mary's Mission Hospitals?
We do not only look at you as a person who is sick, or somebody who is seeking healthcare, or somebody who is insured. We look at you as somebody who is in need of presence. So we realize that you have come as a visitor into our institution, and a visitor is welcomed right from the gate. As you walk into your various stages of the patient journey, you will receive that tenderness, that availability, that ability to just listen to you, as opposed to just looking at you as somebody who is sick and needs fixing. Yeah, so that is very key for us.
Wonderful. Your final words to the viewer before we close the discussion?
To the viewers, St. Mary's Mission Hospital is open 24 hours, 7 days in a week, and this is inclusive of public holidays and weekends, Saturdays and Sundays. Please visit the hospital. Don't stay at home when you are not feeling well. But even when you're well, you want to check your health. Your health is paramount, but you have to take charge of it. So you're most welcome to St. Mary's Mission Hospital. With just 100 shillings, you'll be able to understand something about your health. You'll be able to guide somebody, and you will also be able to give us some feedback that can help us grow. We value your feedback. So most welcome.
Thank you so much, Erokamano sister. Yeah, thank you for that. All right, that's it, Sister Dr. Carren Owuor, the CEO of St. Mary's Mission Hospitals, who has been giving us in-depth details about the two hospitals and why you should choose to consult or seek medical attention from these hospitals. Remember, it's just an introductory talk just to get to know more about the hospitals, the services they offer, and we'll be having subsequent talks focusing on specific units, specific departments, just to enlighten you more on what you should expect and what you should seek out for from St. Mary's Mission Hospitals. This brings us to the end of our discussion, and I would like to complete with one of the statements, which is a mission statement, which emphasizes that St. Mary's Mission Hospitals are determined to offer compassionate and quality healthcare services so that people may have life and have it to the full. So you can visit them on their websites. You can call or contact them to get to know more about what they offer in the healthcare sector. My name is Sasha Elizabeth. Thank you so much for taking time to watch this discussion. But before I wrap up, I'd like to extend my gratitude to the team behind the scenes, starting with the person behind the scenes right before me. This is Michael Ndegwa, the camera operator, the visual mixer, Sami Cherubora, and the transmission person, Peter Mangi. And I would like to also thank Father Vincent Shumila of the Franciscan Capuchin Friars for his contribution and his wisdom. So until next time, goodbye.
St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even non-discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyo mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.